Good afternoon and happy Easter to everyone. We're here for day 387, joined with Chairman Mark Kern, and today we are honored to have Mila on this beautiful Easter day. Thank you for coming in.
Thank
And
you.
You have the numbers for us.
Happy Easter, everybody. So for day, Sunday, April the 4th, we have 35 new positive tests out of a total of 526 for the day. The age range of positive individuals was 10 to in their 90s. Our county positivity daily rate is at 6.7%, with the 7-day rolling average at 4.0%. The regional positivity as of April the 1st was at 2.8%. And luckily, we have 0 new deaths to report today. Countywide, we have conducted a total of 316,805 tests, consisting of 29,502 positives and 287,303 negatives. The total number of deaths to date is 472, and our condolences go out to those families. To date, the number of individuals who have completed their 10-day isolation period is at 28,726. Statewide, we have tested 20,626,612. Total positives is 1,256,634, and that's an increase of 2,449 from yesterday. Total deaths to date is 21,373, and that's an increase of 14. St. Clair County hospitalization numbers. Within St. Clair County, the number of COVID-19 hospitalized patients is at 25, and regionally we're at 51. Patients on ventilators in St. Clair County is at 1, regionally we're at 4. Moving to congregate care, for those in outbreak status, announcing new cases only, Freeburg Care has 2 new cases, Integrity Healthcare of Smithton, 1 new case, Mercy Rehab of Swansea, 1 new case, and Swansea Rehab and Care, 1 new case. Testing continues to be ongoing Monday, Wednesday, Friday, and Saturday at St. Clair Square from 8 to 4. In addition, we have HSHS, Walgreens, and CVS testing options as well. I will say for vaccine, we're still running 7 days a week at the Mass Vac Center. We are closed today, Easter Sunday as well as Wednesday. And our scheduler is down until midnight tonight. That's for routine vendor maintenance. So please check back in the morning to schedule your appointments. We do have availability. Okay, Chairman Kern?
Great. So after this Easter holiday today, we'll go back to just being off on Wednesdays.
That's correct.
Okay. I appreciate it, Milo. Everything seems to be going really well. We hear a lot of good things. So, but people need to sign up and get there, and certainly remember that if you got the first dose, make sure you're getting the second dose. Isn't that important?
That's correct. We run predominantly Pfizer at the Mass Vaccination Clinic, which requires 2 doses, 3 weeks or 21 days apart. You can go longer than that 21 days, but not shorter. Pfizer is approved for those individuals who are 16 and above. We also run Moderna and J&J out of our 330 West Main site, and those appointments are up on that scheduler once it's up, back and running. We have open appointments every day at the mass vaccination site. We've conducted over 74,000 administered vaccines there. For the entire county, we're looking at 133,734. So that's a good number, but we still need to continue to vaccinate, because if you go back to the restrictions and look at that, we're looking at 70% of individuals 65 above and older throughout the state, which we've met, but we still have higher hospitalization numbers than we need statewide in order to reduce restrictions, get to that bridge phase, and then eventually go to phase 5. So it's a combination.
We still have a way to go.
We do.
Thanks, Milo. We'll be back for questions, but I think we'll go into the zip code report right now. 62201 up 1 to 587. 62206 up 1 to 1,316. 62208 up 7 to 1,660. 62220 up 3 to 2,116. 62221 is up 1 today to 2,817. 62223 up 4 to 1,782. 62225 up 1 to 143. 62226 up 2 to 3,244. 62232 up 2 to 915. 62258 up 1 to 1,073. 62264 up 1 to 368. 62269 up 5 to 3,318, and 62285 up 3 to 589. As Mila said, testing's down today, so We had 35 new positives, but only 526 tested, so that makes our county positivity go up substantially today to 6.7%. So we got to remember to get out and get tested if you feel you need it. If you have any chance over the holidays that you think you might have been exposed, get tested. It makes a difference. The higher daily county positivity brings our rolling average up today to 4%, but regional positivity, luckily, is now down to 2.8% today. That's because Bond County calls in at 1.7%, Clinton 2.2%, Madison 3.6%, Monroe is at 8.8% today, Randolph is at 0%, St. Clair is at 6.2%, and Washington County is at 0%. Herb?
We have questions and answers today, just a few today on this Easter day. So Brian, if you would, Brian Whitaker, please give us the questions.
Yes, sir. Milo, we'll start with the health department questions that came in. The first person asked, what is the criteria for a COVID sample to be genomic sequenced?
The sequencing, it can be a variety of things. So Illinois Department of Public Health works with statewide labs in order to conduct basic surveillance. There's some other criteria as well. If someone who's fully vaccinated becomes positive, they'll look at that as well. Reinfection in patients within 90 days. If a provider finds an atypical case presentation, they may send it for sequencing. And any kind of case that's associated with an outbreak or a variant. Those are all reasons why they can be sequenced. And there are some more technical data reasons as well, but I'd refer you back to Illinois Department of Public Health for those explanations.
Okay. The next person said, in clinical trials, Pfizer vaccine efficacy 7 days after the second dose was 95%. Then why is it that people who receive Pfizer vaccine are told to wait 2 weeks after their second dose to be considered fully vaccinated? What is the rationale for that?
So CDC says 14 days for the vaccine to reach its full efficacy. There's various studies out there, and I've seen 90% at 7 days for Pfizer, but you really need to look at the different criteria of the different studies, the population, the time period, occupations, so that you're really looking at oranges to oranges and apples to apples when you're evaluating those different studies that are out there.
Okay. Now the next person asked, was any cases of the new variants detected in St. Clair County so far? Also, what are the chances that the variants could be circulating here?
Today, Illinois Department of Public Health has not made us aware of any variants that are circulating in St. Clair County. However, you don't know who you're next to. It could be somebody who's passing through that you could have exposure to that is carrying a variant. So that's why it's important that you continue to wear your mask, wash your hands, and stay socially distant.
Okay. The next person asked, where and how can a St. Clair County resident sign up for the Johnson & Johnson vaccination?
On our county website, we have the scheduler on there where you can sign up for vaccine. Our 330 West Main does run Johnson several days a week, so if you watch that site as appointments become available, you can sign up. And we do intend to run it again at the fairgrounds, hopefully within the next week. We just haven't had the volume of inventory in order to do that.
Okay. One last health department question that came in says, I'm curious if Pfizer or Moderna are developing a booster or annual shot similar to the annual flu shot.
Okay. Right now, they're not requiring a booster.
Okay, thank you very much, Mila. One other question came in, Chairman and Director Simmons, kind of for both of you as we're involved in this on a daily basis. The person asked, why are we still spending money to have daily briefings?
Happy Easter, Herb.
Happy Easter.
We're all salaried. Everyone in this room we get paid the same whether we're here or not. We decided early on that there needed to be a source of good information, current information that St. Clair County residents and now we find other residents of the state are accessing. It was all done and it's being done as a service, and when the service is no longer required, then we'll go back to Sundays as normal, and perhaps no briefing. But at this time, it doesn't cost anything for the taxpayers to have this done. This is all a service that we provide as part of our job.
Well, and I think you said it right, Chairman. 387 days ago, we made a commitment to the county residents that we were going to keep everybody informed. And I'll remind everybody on Easter here, 472 of our county residents aren't with us today. 21,373 across the state of Illinois. If that alone is not worth you understanding why we continue to do this, we still have people in the intensive care unit. We still have people that are showing positive. And the bottom line is, if you don't want to watch it daily, there's nobody forcing you to do that. We appreciate every member of Team St. Clair that does, and evidently for whoever asked that question, you must be watching it, or you wouldn't ask that question. So, as the chairman said, we're going to be here until we don't have to be here. And if that was today, we'd all be happy. So until we get this virus locked in a closet and put away, we're going to be here. We'll be back tomorrow for day 388 with an update tomorrow. Everybody have a good evening and happy Easter to everybody.
On behalf of the O'Fallon, Shiloh, and Greater Belleville Chambers of Commerce, we ask you to wear your mask, wash your hands, and watch your distance. By doing these 3 simple things, you will be supporting our businesses, all who have had a difficult year, and they need your support now more than ever. The business community understands the risk to our customers, and we want to present them with the safest environment possible. Whether you are able to shop in store, order online, dine outside, order to go, or call for curbside pickup, it is time we all come together. Together, we will